Heart failure is more than just a disease. It's a life-altering condition that affects millions worldwide. It occurs when the heart can no longer pump blood efficiently, leading to breathlessness, fatigue, and fluid buildup. Despite medical advancements, heart failure remains a major challenge, requiring timely diagnosis and effective management. Today, we will explore its causes, types, clinical features, and treatment approaches in a way that makes this complex condition easier to understand. Clinical definitions of heart failure. Different medical organizations define heart failure slightly differently, but the essence remains the same. It's a condition where the heart struggles to meet the body's demands. The American definition focuses on the structural and functional impairments of the heart, while the European perspective highlights the signs and symptoms, like breathlessness and swelling. Pathophysiologically, heart failure is a state where the heart fails to maintain adequate circulation, leading to congestion and organ dysfunction. Regardless of the definition, what matters most is recognizing it early and taking action. Types of heart failure. Heart failure can take different forms. Chronic heart failure develops gradually, requiring long-term management, while acute heart failure comes on suddenly, often as a medical emergency. There's also acute pulmonary edema, a frightening condition where fluid fills the lungs, making breathing difficult. Understanding these distinctions helps in providing the right treatment at the right time, potentially saving lives. Global epidemiology of heart failure. Heart failure knows no boundaries. It affects people across the globe, but its burden varies by region, age, and gender. As life expectancy increases, so does the number of people living with heart failure, particularly in aging populations. While men are more commonly diagnosed with reduced ejection fraction, women more often develop heart failure with preserved ejection fraction. The disparities in prevalence remind us that early intervention and access to healthcare are crucial in reducing its impact worldwide. Racial and ethnic differences in heart failure. Not everyone faces the same risk. Genetic factors, social determinants, and healthcare disparities all contribute to differences in how heart failure affects different racial and ethnic groups. Some populations are genetically predisposed, while others suffer due to lack of healthcare access. Recognizing these disparities is the first step toward addressing them, ensuring that every patient, regardless of background, receives the care they deserve. Morbidity and mortality. In heart failure. Heart failure is a chronic battle, often leading to frequent hospitalizations and a reduced quality of life. It's a progressive condition, meaning that, without proper treatment, it worsens over time. The statistics are sobering. Many patients face repeated hospital visits, and survival rates remain concerning despite medical advancements. But there is hope. Early diagnosis, lifestyle changes, and modern therapies can slow the progression and give patients more time with their loved ones. Economic impact of heart failure. Beyond the human toll, heart failure is a heavy financial burden on healthcare systems worldwide. Hospitalizations, medications, and long-term care drive up costs, not just for patients but for society as a whole. The key to reducing this burden lies in prevention, early detection, and better disease management. If we invest in smarter, more effective care, we can improve lives and ease the strain on healthcare resources. Heart failure. Phenotypes. Not all heart failure is the same. In some cases, the heart's ability to pump is severely reduced. This is called heart failure with reduced ejection fraction, or HFrEF. In other cases, the heart pumps normally but doesn't relax properly, leading to heart failure with preserved ejection fraction, or HFpEF. A third category, mid-range ejection fraction, HFmrEF, falls between the two. Understanding these differences is crucial because treatment strategies vary depending on the type. In some patients, heart function can improve with the right treatment, a condition known as heart failure with recovered ejection fraction. This offers a glimmer of hope, proving that with early intervention and optimal therapy, heart failure isn't always a one-way road. However, continued monitoring is essential, as the risk of deterioration remains. Several conditions can weaken the heart's pumping ability, leading to HFrEF. Coronary artery disease, where blocked arteries restrict blood flow to the heart, is the most common cause. Infections like myocarditis, as well as valvular heart disease, can also lead to heart failure. Identifying the root cause is key to providing targeted treatment and improving outcomes. Causes of heart failure with preserved ejection fraction. HFpEF is different from reduced ejection fraction heart failure. Here, the heart pumps normally but doesn't fill properly due to stiffness. The leading causes include long-standing hypertension, which makes the heart work harder, diabetes mellitus, which affects heart muscle function, and aging-related cardiac stiffness. Unlike HFrEF, where treatment is well-defined, managing HFpEF remains a challenge, making prevention even more crucial. Other causes of heart failure. Not all heart failure cases fit neatly into typical categories. Some develop high-output heart failure, where conditions like severe anemia or hyperthyroidism force the heart to work harder than it can handle. Peripartum cardiomyopathy is another unique form, occurring in women during pregnancy or soon after delivery. Endocrine disorders like uncontrolled diabetes or thyroid imbalances can also contribute. These cases remind us that heart failure isn't a single disease but a final common pathway of many underlying conditions. Progressive nature of heart failure. Heart failure isn't static. It worsens over time if left untreated. It typically starts with mild symptoms, which patients often ignore, but slowly progresses to severe limitations in daily life. The key to better outcomes lies in early intervention. Identifying and managing heart failure in its early stages can slow its progression, improving both quality of life and survival. Ventricular remodeling in heart failure. The heart is a remarkable organ that adapts to stress, but sometimes these changes do more harm than good. In response to chronic pressure or volume overload, the heart undergoes remodeling. Concentric hypertrophy occurs when the heart muscle thickens, making it harder to fill with blood. Eccentric hypertrophy, on the other hand, leads to an enlarged, weakened heart that struggles to pump. Understanding these changes helps in choosing the right treatment to prevent further damage. Mechanisms of ventricular remodeling. Ventricular remodeling is driven by multiple processes. Changes at the cellular level affect heart muscle function, while the extracellular matrix, which provides structural support, undergoes maladaptive remodeling. Inflammatory pathways also play a role, further worsening heart function. Targeting these mechanisms with appropriate therapies can help halt or even reverse some of these harmful changes. Despite their differences, both HFrEF and HFpEF result in heart failure, but their underlying mechanisms vary. HFrEF occurs due to weakened heart muscle contraction, often following a heart attack or long-term damage. HFpEF, on the other hand, results from stiffness and impaired relaxation of the heart, often driven by conditions like hypertension and obesity. These differences explain why treatments that work for one may not be as effective for the other. Neurohormonal activation in heart failure. When the heart fails, the body tries to compensate, but sometimes these compensatory mechanisms worsen the condition. The renin-angiotensin-aldosterone system, or RAS, and the sympathetic nervous system become overactive, increasing blood pressure and heart strain. While these responses may help temporarily, in the long run, they accelerate heart failure progression. That's why many modern heart failure treatments target these pathways to improve outcomes. Vasodilatory hormones in heart failure. Not all hormonal changes in heart failure are harmful. The body also releases vasodilatory hormones like natriuretic peptides and nitric oxide, which help reduce fluid overload and improve circulation. However, in advanced heart failure, their effects become insufficient. Medications like neprilysin inhibitors help enhance these natural protective mechanisms, offering a new approach to treatment. Heart failure is influenced by more than just hormones. Endothelin, oxidative stress, and inflammatory cytokines all play roles in disease progression. These biologic factors create an environment of chronic inflammation and vascular dysfunction, worsening symptoms and limiting treatment response. Researchers are now exploring novel therapies that target these pathways to improve patient outcomes. Recent advancements in heart failure treatment have opened new doors. SGLT2 inhibitors, originally developed for diabetes, have shown surprising benefits in heart failure, reducing hospitalizations and improving survival. Neprilysin inhibitors enhance the body's natural defenses against fluid retention and high blood pressure. These emerging therapies are transforming the way we approach heart failure management. Electrical and mechanical factors in heart failure. Heart failure isn't just about weak pumping or stiff heart walls. Electrical and mechanical disruptions also play a critical role. Dyssynchrony, where different parts of the heart beat out of sync, reduces efficiency, making the heart work harder. Arrhythmias, especially atrial fibrillation, further complicate heart failure, increasing the risk of stroke and worsening symptoms. Recognizing and treating these factors is essential for better outcomes. Secondary mitral regurgitation in heart failure. In heart failure, the mitral valve may start leaking due to changes in the shape and function of the heart. This is called secondary mitral regurgitation. It worsens heart failure by allowing blood to flow backward, increasing lung congestion and making the heart pump even harder. Managing this complication requires a careful approach, often involving medications, devices, or even surgical interventions. Cardiorenal interactions in heart failure. The heart and kidneys are deeply connected, and when one fails, the other often suffers. In heart failure, poor circulation leads to reduced kidney function, causing fluid retention and worsening symptoms, a condition known as cardiorenal syndrome. Understanding this complex relationship is crucial, as managing heart failure often requires balancing treatments that support both the heart and kidneys. Heart failure doesn't just affect the heart, it impacts multiple organs. The liver suffers from congestion, leading to dysfunction and even fibrosis in severe cases. The gut also experiences reduced blood flow, which can alter digestion and nutrient absorption. This multi-system involvement explains why heart failure management extends beyond just cardiac care. Gut microbiome and inflammation in heart failure. Emerging research highlights the role of the gut microbiome in heart failure. Changes in gut bacteria, known as dysbiosis, can trigger inflammation and worsen cardiac function. This connection between gut health and heart disease is a fascinating area of study, opening the door for potential microbiome-targeted therapies in the future. High-output heart failure. Not all heart failure occurs due to a weak heart. In high-output heart failure, conditions like severe anemia, thyrotoxicosis, or arteriovenous fistulas force the heart to pump excessively, leading to eventual failure. Recognizing and treating the underlying cause is essential in these cases to restore balance and prevent further deterioration. Symptoms of heart failure. Pulmonary congestion. One of the hallmark symptoms of heart failure is fluid buildup in the lungs, leading to pulmonary congestion. Patients experience breathlessness, which worsens with exertion and even at rest in severe cases. Orthopnea, or difficulty breathing while lying down, forces many to sleep propped up on pillows. Paroxysmal nocturnal dyspnea, waking up gasping for air, is another distressing symptom. These signs indicate worsening heart function and the need for urgent intervention. Symptoms of heart failure. Systemic congestion. As heart failure progresses, fluid retention isn't limited to the lungs. It manifests as swelling in the legs, weight gain due to fluid buildup, and in severe cases, ascites, fluid accumulation in the abdomen. These signs indicate worsening heart failure and the need for aggressive treatment to prevent further complications. Symptoms of reduced cardiac output. Beyond congestion, heart failure also leads to poor blood circulation. Patients often feel extreme fatigue, struggle with daily activities, and notice cold hands and feet due to reduced blood flow. These symptoms significantly impact quality of life, making early diagnosis and treatment crucial. Heart failure doesn't just affect the body, it impacts mental health too. Many patients experience sleep disturbances, leading to chronic exhaustion. Depression and anxiety are common, driven by both physical symptoms and the emotional burden of a chronic illness. A holistic approach to treatment must address both physical and psychological well-being. Precipitating factors in heart failure. Heart failure can worsen suddenly due to various triggers. Common patient-related factors include excess salt intake, infections, and uncontrolled high blood pressure. Medication non-adherence is another major cause. Missing even a few doses can lead to serious decompensation. Educating patients about these triggers is key to preventing hospitalizations. Physical examination. General appearance. A patient's appearance can reveal a lot about their heart health. In mild cases, they may look normal, but as heart failure worsens, signs like difficulty breathing, sweating, and an anxious expression become more evident. In severe cases, patients may appear frail, with visible signs of distress. Recognizing these cues helps guide diagnosis and treatment. Physical examination. Vital signs. Vital signs offer crucial clues in heart failure. An elevated heart rate may indicate the heart is compensating for reduced function. Blood pressure changes can vary. Some patients have hypertension, while others develop dangerously low blood pressure due to severe heart failure. Careful monitoring of these parameters helps tailor treatment. The jugular vein can act as a window into heart function. In heart failure, elevated jugular venous pressure, or JVP, suggests fluid overload. A positive Kussmaul's sign, JVP rising instead of falling with inspiration, may indicate right-sided heart failure. These simple bedside assessments provide valuable diagnostic insights. Physical examination. Lung assessment. Listening to the lungs can reveal important signs of heart failure. Pulmonary rales, or crackling sounds, suggest fluid buildup in the lungs. Pleural effusion, fluid around the lungs, can also develop, causing breathlessness. Identifying these signs early can prompt timely treatment and prevent complications. Physical examination. Cardiac assessment. A careful cardiac examination provides key diagnostic clues. The presence of an S3 gallop, a third heart sound, strongly suggests heart failure. An S4 gallop, though less specific, often indicates underlying hypertension or diastolic dysfunction. Heart murmurs may reveal associated valvular disease, helping refine the diagnosis. Physical examination. Abdomen and extremities. Heart failure affects multiple body systems. Hepatomegaly, or an enlarged liver, indicates fluid congestion. Pitting edema, swelling in the legs that leaves an indentation when pressed, is a classic sign of worsening heart failure. These physical findings reinforce the need for prompt medical intervention. Diagnostic approach to heart failure. Diagnosing heart failure requires a comprehensive approach. A detailed history and physical examination lay the foundation, followed by targeted laboratory and imaging tests. The goal is to confirm heart failure, identify the type, and determine the underlying cause to guide appropriate treatment. Laboratory findings in heart failure. Certain blood tests provide critical information in heart failure. Blood urea, nitrogen, or BUN, and creatinine levels help assess kidney function, which is often affected. BNP and NT-proBNP are key biomarkers. Elevated levels strongly indicate heart failure and help differentiate it from other conditions causing breathlessness. Chest X-ray. Findings in heart failure. A chest X-ray is a simple yet powerful tool. In heart failure diagnosis, it can reveal an enlarged cardiac silhouette, suggesting chronic heart disease. Pulmonary congestion, seen as fluid-filled lungs, confirms worsening heart failure. These findings help physicians assess severity and guide treatment decisions. Electrocardiogram in heart failure. An electrocardiogram, or ECG, is a fundamental tool in evaluating heart failure. While it doesn't confirm the diagnosis alone, it often reveals crucial abnormalities. Common findings include left ventricular hypertrophy, atrial fibrillation, and conduction delays such as bundle branch blocks. Identifying these patterns helps guide further testing and treatment strategies. Non-invasive cardiac imaging in heart failure. Cardiac imaging plays a vital role in diagnosing and classifying heart failure. Echocardiography remains the gold standard, allowing direct visualization of heart function and valve abnormalities. Cardiac MRI provides even greater detail, particularly for assessing myocardial fibrosis and infiltrative diseases. These non-invasive tools are essential for accurate diagnosis and management. Biomarkers in heart failure. Biomarkers offer valuable insights into heart failure, severity, and prognosis. Natriuretic peptides, including BNP and NT-proBNP, are highly specific markers that rise in response to heart strain. Troponins, typically used to diagnose heart attacks, can also indicate worsening heart failure. Monitoring these biomarkers helps clinicians track disease progression and response to therapy. Invasive studies in heart failure. In some cases, invasive procedures are necessary to gather more precise information. Pulmonary artery catheterization helps assess cardiac pressures, guiding fluid management in critically ill patients. Endomyocardial biopsy is reserved for specific conditions like myocarditis or infiltrative cardiomyopathies. These procedures are used selectively when non-invasive tests don't provide enough clarity. Diabetes and heart failure. Diabetes and heart failure are closely linked, creating a vicious cycle. Diabetes increases the risk of developing heart failure, while heart failure worsens glucose metabolism. This bidirectional relationship makes management challenging, requiring a delicate balance of glucose control and heart failure treatment. Newer diabetes medications, such as SGLT2 inhibitors, have shown promising benefits in heart failure patients. Sleep apnea and heart failure. Sleep apnea is highly prevalent in heart failure and can significantly worsen outcomes. Both obstructive and central sleep apnea lead to intermittent drops in oxygen levels, increasing strain on the heart. Identifying and treating sleep apnea, often with continuous positive airway pressure or CPAP therapy, can improve symptoms and overall heart function. Obesity and heart failure. Obesity presents a paradox in heart failure. While excess weight increases the risk of developing heart failure, once the disease is established, mildly overweight patients often have better survival rates, a phenomenon known as the obesity paradox. This complex relationship underscores the importance of individualized weight management strategies. Depression and heart failure. Living with heart failure can take an emotional toll. Depression is common and can negatively impact medication, adherence, lifestyle modifications, and overall prognosis. Screening for and addressing mental health concerns is essential, ensuring a holistic approach to care that considers both physical and psychological well-being. Heart failure with preserved ejection. Fraction treatment challenges. Unlike heart failure with reduced ejection fraction, HFpEF has fewer proven treatment options. While managing comorbidities like hypertension and diabetes is crucial, there are limited disease-specific therapies. This makes HFpEF a challenging condition, requiring further research to improve treatment outcomes. Novel targets for HFpEF treatment. With limited effective therapies for HFpEF, researchers are exploring new treatment avenues. Targeting the nitric oxide pathway and aldosterone blockade are promising approaches. Ongoing trials aim to establish whether these novel strategies can improve symptoms and outcomes in patients with preserved ejection fraction heart failure. Acute decompensated heart failure. General principles. Acute decompensated heart failure is a medical emergency requiring immediate intervention. Common triggers include infections, medication non-adherence, and uncontrolled hypertension. Management focuses on rapid symptom relief, stabilizing the patient, and addressing the underlying cause to prevent future episodes. Volume management in acute heart failure. Fluid overload is a hallmark of acute heart failure. Intravenous diuretics are the first-line treatment to reduce congestion and relieve breathlessness. In severe cases, ultrafiltration, a process that removes excess fluid directly from the blood, may be necessary when diuretics alone are insufficient. Vasoactive therapy in acute heart failure. When heart failure leads to dangerously low blood pressure, vasoactive medications come into play. Inotropes, such as dobutamine, help strengthen the heart's contractions, while vasodilators, like nitroglycerin, reduce the heart's workload. These medications are used carefully, balancing benefits with potential risks. Heart failure with reduced ejection. Fraction treatment evolution. The treatment of HFrEF has advanced significantly over the years. Beta blockers and ACE inhibitors were the first major breakthroughs, improving survival rates. Over time, newer medications and device therapies have further revolutionized management, offering hope for better long-term outcomes. Neurohormonal antagonism in heart failure. Neurohormonal activation plays a central role in heart failure progression. Medications that block the renin-angiotensin-aldosterone system and sympathetic nervous system have been game changers, improving symptoms and reducing hospitalizations. These therapies form the backbone of modern heart failure management. Novel pharmacologic approaches in heart failure. Beyond traditional therapies, newer drug classes are transforming heart failure treatment. RNI, or angiotensin receptor neprilysin inhibitors, represent a major advancement, significantly improving outcomes in HFrEF. Continued research is exploring additional novel agents that could further enhance care. Device therapy in heart failure. For select patients, devices can dramatically improve heart function and survival. Cardiac resynchronization therapy, or CRT, corrects electrical dyssynchrony, while implantable defibrillators, or ICDs, protect against life-threatening arrhythmias. These interventions have revolutionized the treatment landscape for many heart failure patients. Surgical and interventional approaches in heart failure. When medications and devices are no longer enough, surgical options come into play. Coronary revascularization can help in cases where heart failure is driven by blocked arteries. In end-stage heart failure, heart transplantation remains the definitive solution, offering a new lease on life for select patients. Disease management and supportive care in heart failure. Managing heart failure goes beyond medications and procedures. Transitional care programs help ensure patients stay stable after hospital discharge, reducing readmissions. Palliative care plays a crucial role in advanced heart failure, focusing on symptom relief and quality of life rather than aggressive interventions. Heart failure remains a global health challenge, but advancements in diagnosis, treatment, and holistic care are offering hope. By understanding the complexities of this condition and embracing innovative therapies, we can improve outcomes and enhance the quality of life for millions of patients worldwide. Thank you for your time and dedication to learning about heart failure.